And now, Dental Bites, with the dental hygienists of Dental Post.
Hey everyone, welcome to this edition of Dental Bites. So today, ladies, I want to talk about salivary diagnostics or salivary testing. And is anybody doing it, and do you love it, or are you running into some hurdles?
Well, my office, we just implemented Simply Perio is the one that we are using currently, and we like it. We're using it to definitely diagnose how severe someone's periodontal bacteria is. You know, how much bacteria do they have in their mouth, which has been really kind of eye-opening. I've been really shocked at even my own results. I was very ashamed to see my results. I've made some changes. But then we've also been using it to look at our patients who have had, high caries risks for years. It's like, what is going on? How much, what's going on in your mouth? So we've been using it for that as well, to see what type of caries bacteria they have. But I do have some ifs about it, some gray area. So I'm curious to hear what you guys think.
Allie, what's your patient's response to the information, or when you bring it up to want to test?
They're always open to it. So I haven't had anyone decline it, surprisingly. I thought that was going to be a really big hurdle I've been seeing my patients now. I've been 6 years at my office, and I would think they would say, well, you never wanted to test it before. Why all of a sudden now? But how I kind of present it to them is, I'll say, when you go to your annual physical appointment at your doctor's office, they draw your blood to check, your white blood cells, red blood cells, all of your vitals. So wouldn't you want to know your vitals in your mouth and your teeth? It's the exact, not the exact, but pretty similar. Like, how else will we know what's going on in your mouth without testing what type of bacteria you have?
That's
so
a
once
great
I
way to
presented
put it. Yeah,
they're ready
and
for it.
I love how, as hygienists, we always play that narrative in our head before that they're going to say no. But you came up with a great way to present it, and it's working. So that's awesome.
Yeah, no, it's worked well. I want to say my con with it, though, is I still do not feel completely comfortable explaining what each bacteria is. I can tell that, you're in the red zone and it's a purple complex bacteria, or you're in the red zone of the red complex or orange complex. But really explaining the difference in the bacteria and how I would treat each bacteria differently from the other, that's kind of my gray area. So I'm curious, what you guys think.
I like to use it just to have a risk factor, to know where they're at as far as an adjunctive thought process in approaching their long-term diagnosis or prognosis for whether it's perio, caries, oral cancer risk, right? Because, we can use salivary diagnostics for HPV. So just being able to have even that kind of baseline screening is what I've used it for, not so much as you have a high AA bacterial load, so therefore now we are going to do these antibiotics and these adjunctive therapies. It's more of a, okay, now we have a little bit stronger idea of where you land. But that could just be how I'm using it. I know a lot of people use it to help, like, do I need to do antibiotics for this patient? And then that opens up the whole antibiotic stewardship. And
Oh, don't get me started on the antibiotic stewardship. Let's try some other things before we jump on the antibiotic.
Right. But some of those reports say, for this.
Most of them do. Most of them actually do. And I would encourage anyone that is implementing salivary diagnostics to, regardless of what report you are, to use antibiotics as a last resort, perhaps.
Yes.
try some other products prior to doing that. We really need to understand what we're doing to our patients' bodies when we do that. We get so focused on the mouth and then we forget about like what's happening in their gut and all that kind of stuff. And again, it's a little like the mouthwash discussion that we had last week. Like when you're throwing antibiotics in there, that means you're taking away the good guys and the bad guys. So, you know, finding ways to just promote the good guys is a good thing. So I have actually tried all of like the popular salivary diagnostics. I actually I wrote an article last year where I like spit into all of them one day. And I thought they were really interesting. It was interesting that some of them varied, which, you know, was concerning, maybe. I don't know. It was interesting. But again, it's the knowing what to do with it once I saw it. Like I'm like, oh my gosh, I have high TD and FN. Many people have high FN, by the way, so don't stress about that one. But the TD, and so then I was like, well, what do I do? Like, I'm gonna die. Like I was, you know, I was on death's door for a second. And
It is too, right? We're like, oh my gosh, oh my God.
so the one thing I would say is what I discovered as I called every single company to get some help on like, what does this mean? Some of them are way more helpful and then others. Some, you know, one was like, well, you're the clinician, you should know. And I was like, but I don't know. Where one really sat down and talked to me for a long time and gave me some different things to try and some different adjuncts to look at and really kind of talked me off the ledge that I wasn't on death's door. So if you are considering doing salivary diagnostics, or maybe you're already doing it, check out some of those different companies and see what kind of support they have. Because I think just like anything in the beginning, like you got to learn what to do. And heck, if we went to all of our doctors and we saw high, you know, they saw high cholesterol, they're all going to say something different, right? They're going to be like, oh, I'll do this, or don't eat red meat, or, oh, exercise more, or, you know, whatever. And so I don't know that there is a right answer. We want there to be a right answer, and there isn't necessarily a right answer. But Allie, you've been doing follow-ups on them too, though, haven't you?
Yes. So for our perio patients in therapy, so the first ever therapy I'm seeing them, we test them before I start any of my scaling. Once I complete both sides of the mouth, and then have a follow-up with them about 4 weeks later, so in time, about a month after their initial saliva test, I test them again. And then we compare, you know, are you still in red? Are you still high in any of that bacteria? And a lot of times I was very surprised that they still are too high. You know, it definitely lowered, but they're not in the green zone, maybe in the yellow, but a lot of times they were still in the red. And it surprised me. So I'm thinking, did I do something incorrect? Did I leave bacteria? What, you know?
Right.
So now if I get that type of result where they still have too much of that of the bad bacteria, then I'm going to go into like Perio Protect trays has been something that we've really been implementing. You know, we talk about antibiotics. We don't do a lot of antibiotics, but there have been times where the dentist will prescribe that because they are still extremely high. Yeah, we'll try different techniques, and usually about another 3-4 months, whenever I see them back again, we'll test again and just retest until they're in a comfortable position back into a green or low yellow moderate risk area.
So Allie, you're mainly using it for perio, but
Yes.
you know, there, like I was saying earlier, there's a lot of different applications for it as far as different like caries or HPV. You know, one of my big questions with any kind of salivary diagnostics or any type, like even if we're doing like salivary diagnostics just to get the pH, is understanding what was the patient doing 30, 60, 90 minutes prior to our test. And does that impact the results that we get?
Yeah,
Because,
I'm just going to chew xylitol gum right beforehand, and then I look extra good, right?
right, yeah, or maybe
it does impact.
or
It's
or
like
we did a
flossing 2 weeks
pre-procedure-
before the hygienist, right? You'd be like,
right,
look at the gums.
or maybe they are using a particular brand of mouthwash, or we've done a pre-procedural rinse and then we're like, oh, we're going to go ahead and do our diagnostics. Like, you know, how does that impact our results?
It
I don't know.
definitely impacts, but I do know with the test that we use, they can't eat, drink, do anything with their mouth for 30 minutes beforehand. I don't know if that really makes a huge difference if, yeah, they were chewing xylitol gum an hour beforehand or what, but they do say no eating or drinking for 30 minutes before testing. So I never clean their mouth and then test. I always test it first,
Okay.
do what I need to do, and that's it.
So
Interesting.
do you tell the patients beforehand, hey, when you come in for your appointment, we're going to be doing this, and so don't do this, like, you know, like, oh, it's like fasting blood work. Don't eat after this period of time because we're going to take your blood. So you tell them before they come in.
Yes. If I have
Good.
seen them
Okay.
before and they are established patients and I am able to tell them that, then I do. For new patients that come in, our new patient appointments are 2 hours, and that doesn't include a cleaning. So if I'm able to, you know, I'm already with them. I know I'm with them for an hour, 2 hours, and they have perio or I diagnose anything like that, then I know, okay, they haven't eaten obviously in the last 2
You
hours.
didn't
I've
give
been
them a
with
snack
them.
in that
No
time?
snack. No,
No
they're not allowed
snacks.
any snack, no water, no nothing. They're not allowed. It's just suction. No
You're
smell.
not the flight attendant walking down the aisles.
Just tease that. I can have my snack. They can't have their snack.
That's why we run out really quick and then you come back and go, well, this has been fascinating, guys.
Yeah, I think so too. I think this was just another little great bite into salivary diagnostics, and I look forward to what we are going to talk about next.